My name is Aisling Harris and I'm a registered dietitian with Cree Heart and Stroke Charity. And today I'm going to be talking you through some of my top tips for a heart-healthy diet. So two of the main risk factors for cardiovascular disease that we can manage through diet and nutrition are cholesterol and blood pressure. So in terms of blood pressure, this is mainly affected through salt intake. So ideally, we should be consuming less than about 5 grams of salt per day. And salt is found in most of the foods that we eat, especially any processed or packaged foods. So first tip would be to reduce the amount of salt that you add to your food, be it at the table or in cooking. And my second tip would be to learn to read food labels. So if you have the knowledge of how to read food labels and how to identify the salt content of food, you can make an informed choice and choose the lower salt content foods. The second thing that has a big impact on blood pressure is alcohol. So no amount of alcohol, not even the odd glass of red wine, is good for health. So we would recommend reducing or eliminating alcohol intake and not having more than 1 to 2 drinks per sitting. The other thing that can help with reducing blood pressure is fruit and vegetables. These are a great source of vitamins, minerals, antioxidants. They can help protect blood vessels and your heart, and they can also counteract sodium or salt in our diet to reduce blood pressure. In terms of managing cholesterol, again, there are foods we can include and exclude to help reduce cholesterol. So the main thing to note is that for a heart-healthy diet, you don't have to follow a low-fat diet. It's looking at the types of fats. So there are some fats that are good for cholesterol. These would be things like olive oil, rapeseed oil, nuts, seeds, oily fish, avocado. These are quite heart-healthy. It's the fats and oils, things like coconut oil, butter, cream, mayonnaise, fatty cuts of meat, red meat, processed meats, takeaways, chocolate, sweets, cream, cakes, desserts, fried foods. These sort of foods are going to raise cholesterol, so try to reduce how often you're having these foods. Fruits, vegetables, whole grains, soy foods, plant stanols and sterols can all help reduce cholesterol too. Finally, looking at managing your weight can be helpful for reducing blood pressure and cholesterol. And if you are overweight, reducing your weight by about 5 to 10% can help you see reductions in blood pressure and cholesterol. Another thing to look at, even if you might have a normal BMI, is to measure your waist circumference. So for men, your waist circumference, which is measured about an inch above your belly button, should be less than 37 inches. And for women, ideally, it should be less than 32 inches. If it's above this, you may be at an increased risk of cardiovascular disease. So this is something to keep an eye on and to monitor. So I hope that's been helpful.